Hello and welcome to the Business of Happiness podcast. I'm your host, Dr. Tarryn MacCarthy, and today is going to be such a juicy day, such an excellent episode. And for those of you who are joining me for the first time, welcome to the Business of Happiness, where we talk all about how to rediscover happiness for yourself in medicine and dentistry, how to live the life of your dreams and really experience inner fulfillment while you're serving others, while you're healing others, while you're growing beautiful practices, while you're leading big, beautiful teams. The question, the foundation was always, is it possible? And not only is it possible, but it's a requirement in order to achieve success. And something that I've really been focusing a lot on recently is, has dentistry and medicine asked us to disconnect from our relationship with ourselves? Have we lost our soul connection to an industry of depersonalization? And this depersonalization is happening constantly as we become more efficient, as we create higher and higher requirements and protocols and number requirements for the end of the day, the end of the week, the end of the month, as we start demanding certain outcomes from our human interactions, from our human bodies, from the treatment we deliver as healthcare providers. But you know, this depersonalization comes at an enormous cost. And the cost is so much further reaching than just the cost of our patients' health. It's costing us ours as healthcare providers. You know, long before scientific method, doctors actually were really good at listening to their intuition. Long before we understood the role of bacteria, long before we understood how the body worked, the science behind our anatomy and our physiology and pathology in our body, long before research around pharmaceuticals, doctors listened primarily to their intuition. They knew and worked with families over generations, right? They treated parents and grandparents and great-grandparents and great-grandchildren. And they understood how families carried certain traits within the family. And they didn't always have the lab results in order to point them in the right direction, but they had an intuition about patients. And now we've swung so far in the other direction. That pendulum has swung so far that we don't even look our patient in the eye when they come into the office. We're too busy taking notes on the computer looking in the other direction. Am I right? You know, a couple weeks ago, my husband, as many of you know, is an oral surgeon, and he was on call. And one of the patients, he was on call for the hospital, which means he treats patients who come into the emergency room that are not just patients of his private practice. And he had a young man, I think he was somewhere between the age of 18 and 20. And he said to me, Tarryn, this boy looked like he wanted to die. But the strangest thing is all the lab results came back fairly mild, but he looked like he wanted to die. And I challenged him a little bit on that. I said, Killian, what do you mean he looked like he wanted to die? He said, well, you know, he looked kind of gray. He just lost that spark of life. I said, what is that? Does that mean that every patient who has that gray pallor is about to die? And he said, no, it's just, you know, I can't put my finger on it. And it was the strangest thing because we got all the lab results and his white count wasn't that high. And, you know, usually after taking out wisdom teeth, that's our biggest concern is there's a massive infection in there somewhere. He said, but the white count wasn't that high. So it didn't really make sense, but I had this intuition that something wasn't right. And I thought, let's just admit this kid and watch him. Even though none of the lab results gave the criteria for admission into the hospital for an overnight stay. Fast forward now, what actually ended up happening is he stayed for 14 days. Why? Because he had intense necrotizing fasciitis, which was not at all detectable in the early stages. And Killian saved his life. Very easily could have sent him home that night and not thought twice about it because the lab results did not show a high white blood cell count. And why? Because the bacteria that this boy was harboring actually prevented white cell production. No one could have seen that coming. But it was the intuitive listening that gave Killian the insight to admit him into the hospital that night. And what is that? It requires deep self-trust. And I've been thinking so much about this recently because so many times we tell ourselves that our feelings are not trustworthy. It's kind of been embedded in us in dental and medical school. Don't trust yourself. Someone else outside of you knows better. How often do we tell our bodies that? You go into work, you're not feeling great, so you push through. You tell yourself, come on, Tarryn, this isn't so bad. Keep going. You should feel so lucky. We second guess ourselves. We gaslight ourselves. We tell ourselves that about our careers. I shouldn't feel this way. I should be happier. Look at this. I got everything around me that I could possibly want. I should be happier. We tell ourselves over and over again to stop trusting ourselves. But giving yourself permission to tap into your intuition as a dentist or a business leader is one of your greatest skills. And it requires feeling. See, because the reality is we can't always trust the thoughts we're thinking. Your thoughts are not trustworthy. What? I know this sounds crazy because I just told you to trust yourself, but your thoughts are so often echoes of the words and the proclamations that other people outside of you have made. You know, your professors, your teachers, your foundations, your upbringing, your community where you grew up, your religion, and how often were you told you were wrong and fed information that you were told to believe. Our thoughts are so often just echoes of the things we've heard over and over and over and over and over again. And if you keep thinking a thought, that thought eventually becomes a belief. But what is trustworthy is the way you feel. When you feel happy, when you feel sad, when something lights you up, that is an indicator of something that matters to you. That is an indicator of something that feels aligned and purposeful to your soul. And yet, we tell ourselves we can't trust those things. You know, that uncomfortable feeling you get, or that elated feeling you get, or when we question ourselves and we say, I shouldn't be feeling that way. Anytime that language enters into your mind where you tell yourself, I should or I shouldn't, know that it's a self-judgment. But intuition is not intellect. And so often we try to reason our way through it, to reason our way intellectually in terms of understanding our feelings instead of just allowing them. See, that's the secret, is feelings deserve to be felt. And I know I'm talking about emotions at this point, and your emotions are your indicator light. They're your indicator light that there's something going on. Not necessarily that there's something nefarious happening in your environment, but that your body is telling you something. Intuition requires self-trust. It's listening to that inner whisper, that gut feeling, trusting that the way I feel is valid. The way I feel is important and appropriate and trustworthy. I think so often we tell ourselves, I shouldn't feel that way because it's not professional. It isn't appropriate. So what I'm thinking of now is, any time that a patient has made you feel angry or upset, we often will tell ourselves, I shouldn't feel that way. But that feeling matters. It doesn't mean you need to take your anger out on your patient. Not at all. It doesn't mean you're not still responsible for holding a safe space for your patient as a healthcare provider, holding that professionalism, but you deserve to feel that feeling beyond that appointment. You deserve to create time and space for yourself to feel what came up for you during the day. It's such an important part of maintaining that trust of you with you. And yes, we can never trust our thoughts, but you can always trust your feelings. Your feelings deserve to be felt. And what's so beautiful is when we allow ourselves to feel our feelings, we actually process them all the way through. One of the foundations of developing self-trust is giving yourself permission to feel, even if it feels inappropriate or uncalled for. Another example of this is many times I felt ashamed or guilty for feeling a certain way about my own children, right? When my children upset me or hurt me. And I think, oh my gosh, I shouldn't be angry at my son. No, it's okay. It's okay to feel anger. Maybe not okay to express or take out your anger on him. No, of course not. But feeling it, there's a very big difference. There's a very big difference between expressing and dumping your anger on someone versus giving your body permission to feel it and not making you feel wrong. Stepping away and saying, okay, I'm feeling so angry about it. I'm going to feel this feeling. I'm going to process this emotion. I'm going to give myself permission to feel this feeling. Then once I've fully processed this emotion, I can go back and now I can continue this conversation with my son. The same is true with the people we're working with every day and the people we serve. It is so important to give yourself permission to feel your feelings. Imagine this, 3 days away from work, 3 days away from your regular life, from your family, from the day-to-day hustle and bustle, to just rest and reconnect with you. Here's the truth. Nobody knows you like you do. Nobody knows the joys and the sorrows and the fears and the frustrations and the stresses and the overwhelm and the exhaustion and your patience and your team and your family. Nobody knows what you're going through better than you. Nobody knows what brings you joy and fuels you and fulfills you. Nobody knows your dreams and desires like you do. And the secret to how to access that beautiful wisdom inside of you, the guru inside of you, waits for you at the Empower Her retreat. This incredible retreat happening this October 17th through 20th is an opportunity for you to fall back in love with yourself, to identify your directional compass, and to lean into trust, self-trust, the trust of that inner wisdom. www.empowerherretreat.org. Join us there. Sign up. There are only a few spots left. This is your opportunity to change the direction of your life. So sometimes I get this question, well, Tarryn, how do I know the difference between a gut feeling and fear? That, my friend, is the power of a practiced listener. It requires slowing down. So I want you to imagine yourself in relationship with yourself, just like a relationship with another person, right? And how do we develop trust with another person? The way we develop trust with another person is we listen and we give validity to that person and how they feel, right? And then we support them in how they feel, or at least, the very least, we acknowledge it. So if you think of somebody who you really trust, why do you trust them? Because they listen, they slow down, they look you in the eye probably, they stop doing what they're doing, and they give you their full attention and they say, okay, I'm here for you, I'm listening. And they don't make you wrong. They don't say, well, you really shouldn't feel that way. No, they give you the time and space and the value of what you have to say. That goes a long way in developing self-trust. And in developing trust in that relationship. Another thing is they are integrous with their word. That develops trust, right? So when they say, hey, I'll pick you up at 3:00, they show up at 3:00 and you think, well, this is a trustworthy person. They say, you know what? That really was private. You didn't want me to share it with anybody else. I won't share that with anybody else. And they don't. That is an integrous person who's trustworthy. Okay, so we have great clarity on what creates trust between two people. How about we use those exact same components in developing trust for yourself? Number one, giving yourself space and time to hear and listen. How do I feel right now? And one of the things I think is such a great practice for us as practitioners, as healthcare providers, especially those of us seeing anywhere from 10 to 70 patients, 100 patients a day, those are a lot of interactions. Chances are something felt uncomfortable or scary or sad or fearful, right? Chances are there was something that happened in that day. giving yourself that transition time at the end of the day before you go home, where you could just kind of check in with yourself and say, hey, Tarryn, how are you feeling? How did the day go? Oh, it was a little scary when the suction machine broke in the middle of 2 procedures, and I was really scrambling with gauze and cotton. And that was really activating, and I was a little scared, and I felt my heart rate go up, and I'm still feeling a little anxious from that. My blood pressure was up. Okay, you're allowed to feel that way. I think we create these expectations of ourselves that, I shouldn't feel stressed out by the suction machine dying today. No, you are allowed to feel anything you want to feel. It's the thought that you get to question. The thought was, I shouldn't feel this way. That thought we get to ask ourselves, is that the truth? But the feeling is valid. And imagine if you were able to, at the end of every day, just kind of check in with yourself. Tarryn, how are you feeling? You know what? Telling that woman she has cancer really impacted me. She has 2 young kids. And then giving yourself space to feel the feeling, to not just push through and push past, right? This is how we get back to our humanness. This is how we get back to our soul connection with ourselves. This is how we become even more impactful, powerful healthcare providers and don't lose ourselves in the process, because it's that depersonalization that doesn't just happen between you and the patient. It happens between you and you. And I'm telling you this from my own experience. I will never forget all those years ago. Let's see, what was that now? 13 years ago? 14 years ago? Looking in the mirror and not even recognizing the woman who was looking back at me. I sure as hell didn't like her, but I didn't even know who she was. I looked in my eyes and I didn't even know that woman. I didn't know what she liked. I didn't know what she didn't like. I didn't know what her dreams were. She didn't know. All I knew is that I was trying to make it one foot in front of the other every single day, and made myself feel wrong all the time. Made myself feel like I wasn't good enough. I didn't feel good enough at anything. I kept looking outside of myself for the answer. How easily we allow that depersonalization in this profession, but how easily we can get it back, that reconnection with ourselves. And one of the things it requires is taking the time and space, giving ourselves an opportunity to quiet the noise in our own heads, giving ourselves permission to slow down. And is your body going to fight you on this one? Yes. Is your body going to say, Tarryn, you already took a 2-week vacation. You can't slow down now? Yes. Because we've been functioning under this paradigm of overachieving, overfunctioning, overgiving, exhausting ourselves. And often it doesn't occur to us until we burn down that we actually get to make another choice. Building, rebuilding that connection to yourself turns out to be one of the most valuable skills, not just in medicine and dentistry and treating our patients. I mean, we all know that intuitive moment. You know that moment when I'm going to go to general dentistry for a moment now, when you're chasing decay and you're nowhere near the pulp, but something in you, that intuitive knowing, you're like, this is going south. And before you even get to the pulp, before you see that little pinprick of blood, you think, okay, I'm going to pause and just check in with the patient and let them know where we are here for a moment. Let them know of what I'm anticipating happening. That's your intuitive knowing. That's your skill and your expertise and years of clinical expertise that is building, but it's the trusting of yourself that has to step in. And it's trusting yourself that grows successful businesses. It's trusting yourself that gives you permission to hold boundaries. It's trusting yourself that says yes to the things that light you up and no to the things that are draining you. And those small choices are everything. Those small choices are the compounding that leads either to burnout or living the life of your dreams. And they're founded in the sense of self-trust. So just for a moment, I want you to picture a woman who has great dreams. She wants to experience enormous success in her life and financial freedom. She wants love. She wants adventure. She wants connection with her patients. She wants to leave work at the end of the day and come home and have so much space and freedom of her time and clarity of her mind and presence that she can be present with her children and feel like every moment that she has with them is full and precious and valuable and appreciated. She wants to have gratitude for all the good things in her life. She wants to say yes when friends ask her to come to important moments in their lives. She wants to know that her priorities and her values are important. She wants to be a good leader to her team. I want you to also imagine that she beats herself up, that she doubts herself all the time, that one day she gets up and she's feeling exhausted and overwhelmed and she has a headache and she thinks, you know what? I shouldn't have done that. You were wrong. You ate the wrong thing yesterday. You always do this. I'm going to punish you today and get up. We're going to work out because this is ridiculous. Enough excuses. And she shows up to work and she pushes through and she ignores that headache and she just keeps taking pills for it. She keeps beating herself up. And the numbers start going down in her practice maybe 1 month, and she starts thinking, I knew I couldn't do this. I knew I wasn't good enough. I knew I wasn't a good enough business owner. She keeps telling herself she should be so happy. She should stop feeling so disillusioned. She keeps giving all of the power of her decisions over to the experts, reaching outside of herself, learning more from others to know what to do. Calling up friends, calling up experts, constantly doubting herself. I want you now to imagine a second woman. Same dreams and desires, same fears, same expertise. Maybe she's not even as good at dentistry as the first. She also wants financial freedom. She also wants to feel good at the end of the day. She also wants time for her family. But this woman trusts herself. When something doesn't feel right, she speaks up. From a place of calm confidence, not blame or anger, just a deep knowing. When she doesn't feel good, she asks for help. She sets boundaries. She maybe even calls and cancels a patient if she's got such a bad headache she can't think. She trusts the way she feels. She doesn't let anyone else gaslight her or make her feel wrong, least of all, the voice inside her own head. She makes mistakes, sure. She'll make choices and take leaps of faith that don't turn out, and she'll have months and years where the numbers go down, but her deep sense of self-trust gives her the motivation and the confidence to choose again, knowing that every bump in the road is just data, getting her closer and closer and closer to a deeper understanding of what matters most to her. I want you to just imagine those two women for a moment. Who do you think will experience a deeper sense of satisfaction, of fulfillment? Which one of these women do you think would develop a deeper sense of connection to other people? Which one of these women do you think will have deeper, truer, more meaningful relationships in her life? Which one of these two women do you think will feel more rested? Will feel like there's an expanse of time? Which one of these two women do you think will be a better healthcare provider? Whose hands do you want to be in as a patient? Whose team do you want to be on as a team member? It's really interesting because I think we tell ourselves that by chasing ourselves with a stick and making ourselves wrong, that's how we're going to improve and be better. Be a better boss, be a better business owner, be a better healthcare provider, be a better dentist, be a better mom. But it's the exact opposite. Because when you feel bad about yourself, your decisions are made from reactivity, from fear, from trying to compensate for not being good enough. And when you trust yourself, you take care of yourself. And when you take care of yourself, you feel better, you feel good. When you feel good, you have the clarity of making good decisions. It's possible. It's possible to find that sense of self-trust. We do not have to lose our soul connection in an industry of depersonalization. In fact, it's an opportunity in this industry to really shine, to create a unique sense of excellence within this industry when you actually learn to start trusting yourself. And it starts out small, especially when you've done the opposite for so long. It starts out by not making the way you feel wrong. It starts by following through on the promises you make to yourself. Tarryn, I'm going to give you a day off, and actually doing so. It starts by listening to that inner voice when somebody asks you to do something and you realize, I am exhausted, I don't have any more left, and you get to say no. It starts by taking care of yourself and rebuilding that relationship with yourself. And you deserve it. Your patients deserve it. Your team deserves it. But most importantly, your future self and your little girl self, all the parts of you deserve you taking care of you and learning how to trust yourself again. Thank you. Thank you for listening to this beautiful episode. Thank you for caring enough to know that taking care of yourself is actually the biggest gift you can give to the people around you. And remember, when you feel good, that, my friends, is when you can do good. Bye-bye. Hey, beauty, if you enjoyed this episode, then like and subscribe to the show and receive this beautiful message of empowerment, remembering what you are capable of and the purpose you serve in this world every single week. And if you know of a colleague who needs this message, share this episode with her. This is how we raise the collective in healthcare, reminding one another and supporting one another. Community is the answer. This is how we grow it. And lastly, I invite you to a phenomenal in-person event this October 2024, the Empower Her Retreat, exclusively for women in medicine and dentistry on the beach. It will change your life. And I cannot wait to see you there. Check out the details in the show notes and have a phenomenal day remembering that you are enough.